Thanks for staying with us. March 18th every year is World Young Rheumatic Diseases Day. It's a day set aside to raise awareness for rheumatic diseases in children and young people and empowering them to thrive. So joining us in the studio is Nigeria's first pediatric rheumatologist and consultant pediatrician, Dr. Ayodele Faleye. He's also an employee of Lagos State University Teaching Hospital, LASUT. Welcome to the show.
Thank you very much for that welcome.
First,
thank you.
Pediatric rheumatologist.
Pediatric rheumatologist.
How did that happen?
That happened when I was in training as a resident doctor at the Lagos State University Teaching Hospital in Ikeja. We were having children on the pediatric ward, but we have to send consults to the adult side before they can be seen on the pediatric ward. That was when I noticed that gap, that, there's no one within the building who is a pediatrician that can be attending to these children. So I joined the adult rheumatology unit for 1 year for a training because there was no pediatrician in Nigeria to train me.
Wow.
So after then, I proceeded to South Africa, the University of Cape Town and the Red Cross War Memorial Children's Hospital for 1 year. And after that, I won a fellowship, like a scholarship in the UK, to be precise, Liverpool, the University of Liverpool and the Hilda A. Children's Hospital. Then after my training in 2022, that's February 2022, I came back to LASUT.
Well done. Well done.
I'm grateful the LASUT management, the Department of Pediatrics and the adult rheumatology unit, they supported me and they created the Pediatric Rheumatology Clinic and a unit. So now we have the clinic once in a week, then we have our patients. But prior to that, it was a struggle.
Wow. Yeah. Congratulations.
Thank you so much.
Thank you for coming home.
Yeah.
Thank you.
Yeah,
Thank
exactly.
you.
For not disappearing there.
Yes, now.
So tell us about this rheumatic,
rheumatic diseases.
Rheumatic diseases.
Okay.
How does it present in children?
Thank you so much. When we hear the word rheum, what should come to mind are the joints. You know, in the community, you hear rheumatism, everything. At the joints.
Like
It's either
people like us.
It's either the joint is painful,
Okay.
that's what we call arthralgia, or is swollen, painful, warm, and the individual is unable to use it. That is arthritis.
Okay.
It's not arthritis until it is swollen. Joint pain is different from arthritis. When you say you have joint pain, you are talking about arthralgia. But when it is swollen and there is pain, and at the same time you're unable to make use of that joint, then that is arthritis. Now, I'm here to tell us this, that arthritis do occur in children. Children can have arthritis. You know, when you hear arthritis, you'll be thinking, elderly people, you know, due to wear and tear over the years. You see, especially in women, you know. But I'm here to tell us that arthritis do occur in children, and the type of arthritis that a rheumatologist sees is the autoimmune type. Most of when you say rheumatic diseases, you are saying that you are talking about diseases that affect the musculoskeletal system. Is either the skeleton, you have the joints, you have the bones, you have the muscles, that are not due to trauma. That joint is painful. That joint is swollen, that joint is warm, you're unable to use it, and you did not fall down. And it has lasted for at least 6 weeks. Chronicity. I'm not talking about 2 weeks and then you are fine, probably because, you know, you walked around and you're tired or stuff like that. But something that has persisted, affecting daily living, chronicity, then you start talking about rheumatic diseases. Now, let me further tell us that they are mostly diseases of autoimmune origin. Not everything, not all that we manage are autoimmune diseases, but almost all that we see are diseases of autoimmune. What do I mean by autoimmune origin?
That's what I wanted to ask.
Because I don't want to be blowing grammar that we are not going to understand.
Exactly.
We all have the immune system. The environment is not 100% hygienic. You touch the table, we breathe in here. We can do without breathing. We breathe in, we go around, and even if you use your hand sanitizer, you know, sometimes you forget. So we come across germs all the time, but we are not sick all the time because we all have the immune system that protects us, fights against infections or germs that we come across every day today. But sometimes the immune system goes erratic. Now cannot recognize the body again. Instead of fighting germs that we come across, they start fighting the body. So when they pick on the joint, they tend to destroy that joint. When they pick, apart from the joint, you know, I talked more about the joint because that is common to all our diseases. Now there are some of the diseases that we manage that can affect the eye. That means the child affected can go blind if special care is not taken. The kidneys could fail. The heart could accumulate fluid. The lungs could accumulate fluid. Breathing could become difficult. We could have children with irrational talk. That is brain involvement. They don't know where they are again. So those are some of the symptoms that these patients do present with. Now, your question is still, what are rheumatic diseases? Now we have several types. The most common one is the one we call juvenile idiopathic arthritis. That means the child has a swollen joint that has lasted for at least 6 weeks, and the individual must be less than 16 years before you can say this is juvenile. Now that is the most common one. Now we have what we call juvenile lupus. I don't know if you've heard about lupus. Yes, we have quite a lot of them in the clinic. These are diseases that have been termed to be rare. But to me, I will say it is not rare, but we are not looking out for it because we don't know about it. Most of the times we found out in lawsuits that most of the patients that we thought had infection in the past that we were administering antibiotics to for months, keep going home, coming back, they are likely to be cases of autoimmune disorders that we did not diagnose and we lost before the subspecialty came in, you know, because most of the signs and symptoms of these diseases will mimic what we have commonly in our environment, like malaria, the so-called typhoid people talk about, TB. You could find a child coughing for months, losing weight, and you know, you keep screening for TB. Some will even do presumptive TB treatment. The child is not getting better, and the organs are getting damaged. It will be a case of lupus. So the issue we have is that there is underdiagnosis, under recognition. This subspecialty is not part of the medical school curriculum till now. Yes. So we are not being taught in the medical school. Most people are graduating, they don't know about this. Is it that the parents have poor health-seeking behavior? No, they don't. Most of them will have been to the hospital in and out. The healthcare worker too does not understand what is wrong with the child. So, and that is why we are using the opportunity of today's celebration. In fact, I must thank you for being part of our celebration. You know, you are promoting the subspecialty. What we are trying to tell people is that it's now beyond malaria, it's beyond infection, it's beyond TB. We have heard a lot about all this. Let's look at this particular, you know, subspecialty. Now, we have been in the clinic for almost 3 years now. The clinic was created on the 15th of February. Now we have almost 200 children with these diseases.
In Lagos?
Yes.
So okay, let me ask you my question. Is it common here? Because we don't hear of it, but the only reason we don't hear of it is because we don't know it.
Yes.
So I was going to ask, do you really have patients? So we have it here.
Yes.
Okay, so let me ask you this question. Like the rheumatic, sorry, Nima. So I wanted to ask you this question. Is it that you just the child just sits down and just start having that joint pain or something?
Yes.
Because I remember my daughter was complaining of this, or could something have triggered it?
Okay.
Because when she used to run for her house, and then after some time she started complaining about her knee. Would it have been that maybe that was what made it maybe caused that thing? Because she had to go and see a rheumatologist at some point because of that joint, because she was always complaining about the pain.
Joint pain.
Yeah, the joint pain.
Yes. You know, not all joint pain and swelling in children are due to of autoimmune origin, like I mentioned. But when we talk about the kind that a rheumatologist that is of importance because of morbidity and mortality that can cause death, their arthritis is usually termed inflammatory. When they wake up in the morning, they are stiff. They are unable to jump out of bed immediately. When they come out of bed, they limp for about 30 minutes to 1 hour before they, you know, get balanced with their musculoskeletal system. And there is another type. It has nothing to do with when you first wake up. It is after you must have gone around during the day and you are tired, you have the pain. Now in little girls, we have what we call growing pain. they can have it in the lower limb while growing, and they do overcome it. That may not be of autoimmune origin. It's due to growth, and as they grow, it resolves. Likely that is what and they also see us. So, but it is not of autoimmune origin.
Okay, doctor, I wanted to ask, because I'm worried as you're discussing some elderly illnesses and informing us how they're common in kids, in children. What are the chances of the children that you have seen? Are they able to beat it, recover from it over time as they grow? Because sometimes locally we say the bone is soft, they grow for hand again. Are they able to beat it? What are the chances of survival when it causes a mortality risk for them? Is it something that with some early detection and help they can get better from?
Yeah, thank you for your question. That is a bit emotional. Okay. Most of these diseases are chronic. They are for life.
Hey.
There are some of the diseases in which those children can outgrow, like juvenile idiopathic arthritis. Some children are lucky. It's resolved, and they are now off medications. In fact, those are the children I give 1-year appointments. Just go to school, see me after 1 year. I just want to see, hope you are still fine, and they are off medications. But for those that we have called, the juvenile connective tissue disorder, like lupus, juvenile dermatomyositis, scleroderma, we have all these in clinic. It's not to exaggerate. Those ones, they live on medications throughout life.
Oh.
The reason being this, it's just like having sickle cell disease. They have crisis. These ones too, they have what we call flares. You place them on medication. Sometimes probably they have outgrown the dose. You have to adjust the dose. In the course of doing that, they can come back they can come down with the symptoms they presented with a diagnosis, or with those symptoms that were not there at diagnosis, which we call flares. New ones coming up. So they must, stay close to their doctors. Follow-up is very important. Yes.
Does their blood type or genotype predispose them to? Because I had my best friend, she's late now. She used to have rheumatism when we were in secondary school, and it was very she wouldn't attend school.
Yes.
And then she later passed, and the blood type was supposed to be SC. And my former PA is always, from childhood till date, always in rheumatic pain. So she can't do cold water. Sometimes she go days without taking her bath. Does their blood type predispose them to this kind of rheumatic pain? And
I like that question. Sickle cell patients with sickle cell disease or sickle cell anemia, they are different, but I won't go into that. They can be predisposed to rheumatic diseases because they are at risk of infection, and their immune system can go overactive, and sometimes they could now develop one of these diseases because of the hyperactivity of the immune system. Let me share my experience with you in Lasuth. We've had children with sickle cell anemia that were coming in and out of the emergency room. Each time she comes for blood transfusion. The PC will have gone down again, over and over with this fever. Within 6 months, she was transfused 13 times.
Whoa, that's huge.
So then I was in training with the adult rheumatologist there, and I came to the pediatric department to give a talk during a grand round, and the unit was now I came to talk about neonatal lupus because there are
neonatal too.
Yes, but it's so the issue. I came to talk about it, and the unit now felt, maybe we should allow the rheumatology unit to review these patients. And when I moved closer, lupus has some characteristics. I looked at the joint, then on the face, there were some skin rashes. They were looking like that of lupus. We asked them to take blood samples, and it was actually a case of lupus. A sickle cell anemia patient with lupus
again.
Yes, they are predisposed. They can have this, and there is an article on Google that I wrote an abstract 2 years ago on coexistence of rheumatic diseases with sickle cell anemia, where I reported, I think, 5 to 6 patients that we have seen. Some even do have juvenile idiopathic arthritis among the sickle cell anemia patients.
My heart is so broken.
So when the child, becomes an adult, the medication must change
To adult, yeah.
To
Yes,
the
we
adult
use the
dose?
same-
And do they have a chance of it's like evening out? It's not so bad because they become adults.
Yeah, it's the same medications that we use to treat.
Okay.
The only thing is that, in pediatrics, we use the weight and the height to calculate the way we do our things
For
is
children.
just different from that of adults. We need all body anthropometry to calculate the dosage of our. So it's the same drug, and when they grow into adulthood, usually at the age of 18, we let them go to the adult side. Though I'm struggling with that because most of my patients don't want to leave the clinic. They want to stay with me, but this is pediatrics. You have to move to the adult side.
Yeah.
So there's no much difference. We just give them a detailed referral. Then we have a meeting with the adult rheumatologist before they transition to the other side.
Are there
Okay, so
things
do you
that we can
sometimes
do at
correct-
home to help them to get better life? Someone suggested hot water bottle when they have those, because I think it was cold that used to cause the rheumatic pain. So are there things that we can do? Warm socks? Are there anything outside
To
medicine?
make life easier
Oh,
for them.
yeah, that we can use.
Yes. For the issue of rubbing, some do massage or hot water.
Aboniki and all that.
One has to be careful. Aboniki, yes, I heard. One has to be careful. Personally, we don't advocate or we don't encourage them to go for a massage or rubbing, especially when inflammation is active. Imagine a child with a swollen joint that is painful. I'm careful not to refer even to a physiotherapist on time. I want to bring down the inflammation first. The pain should have subsided because I don't want the child to cry. So it is when we are done with that we can say, okay, if you want to now go for exercise, because before most of them come around, they have lost function in that joint. There is contracture. I understand what you are trying to say. It's either the wrist completely bent. There are children in the clinic that their neck can only look forward. They can't look at the sides anymore. They can't look at the back. Because the joints in the neck, they've been affected and they are stiff. Yeah. Imagine having a child giving us history of 6 years. And they've been going in and out of even teaching hospital. Yeah. And they were telling them that they will outgrow it. They should be putting cold ice block and stuff on it.
Because they don't know about it.
They don't know they lose function.
Yeah,
so do you sometimes correct, can it be corrected through surgery?
Yes. Yes, but that is because before you can even go for surgery, they will see us. The inflammation must be properly controlled. It is when it's controlled that we now start gentle physiotherapy. Okay. Some may regain the function, some may not. Yeah.
And so we have to go, doctor. But I wanted to know how many are you in that department, and are there other people who are interested in this line of medicine? Do you have people who are learning under you? Do you have students now who are interested, who are reading up on this? Because you were like 1 in a million. And we'd like to see, because this has become prevalent, we have a lot of these cases, many more people picking interest in this particular aspect of medicine and going into it. Do you see that happening? And do you have people under you as well?
I don't have. In fact, my colleagues were disappointed I came back home to be talking about this. That probably I should have stayed back in the UK and be looking for ways to join me, that I should have told them about how to join me back there. Whoa. Yes, they felt so disappointed. They felt I'm weird. So most people now, the issue of Jacques syndrome, the issue of the fact that you have to be going out for advocacy, raise awareness. Who wants to work? This is hard work. This is hard work. You have to talk about it. You have to save lives. You have to bring these children to clinic. You have to have a good relationship with other specialists who are struggling, probably with the patient they are managing, and they don't have a diagnosis.
Is it fatal?
It could be fatal when they do not present on time. Delayed and that is why we are creating awareness. Is there any child whose joint is always swollen? Is there any child who's always having fever, who is always sick, does not want to go to school? Is there any child who is having mouth ulcers recurrently, sores in the mouth, losing weight, ear is falling off without cutting it? Those are the kind of children.
Thank you so much, Dr. Ayodele Faleye. Thank you for joining us today and sharing awareness. And we hope that more people will see this as an opportunity. I hear a lot of people want to go into medicine, looking for the aspects they want to, focus on. This is also another aspect. We need people like Dr. Faleye here with us in Nigeria. Please, all of you should not japa. Oh. Thank you so much, ladies, for your contribution. Thank you for being on the show today. We had a good time. We had a dramatic time. We had a YK time on the show, and we'll see you again tomorrow. Do have a lovely day.
Yeah. Thank you. Bye-bye.